Hello, I am urologist Omer Erdamakaya. The topic we will talk about today is whether men who receive long-term testosterone therapy are more or less likely to develop prostate cancer than those who do not. Are they more or less likely to develop complaints about prostate enlargement? Let's talk about this in this video. Currently, the use of anabolic steroids is constantly increasing. People are using anabolic steroids for decades. Or after a certain age, there is a decrease in testosterone production in the body due to aging. Then we ask patients to undergo testosterone replacement therapy and patients benefit in terms of general health and general well-being. It is not only about sexuality, erection or libido. Testosterone therapy is also very important for the patient's bone health and vascular health. When we give testosterone therapy to these patients, what happens to them in terms of prostate enlargement or prostate cancer? A new study with a very high level of evidence was conducted last year on this subject. The peculiarity of the study was that testosterone was given to one group and the other group was given fake testosterone. 2,500 patients were followed for 2 years. The number of patients is quite good and the follow-up period is not bad. When we look at the results, about 1% prostate cancer was detected in both groups. In other words, there was no difference between those who received testosterone treatment and those who did not. Of course, we know that testosterone treatment does not develop prostate cancer. But what we are afraid of is that if the patient has a hidden prostate cancer, if there is a cancer tissue hidden in the prostate, living there silently, when we give testosterone treatment, we can exacerbate and mobilize it. The patient's blood values may start to change. We may have to perform an unnecessary biopsy for a benign prostate cancer, a prostate cancer that will not make any change in the patient's life, because the PSA rises. This can upset the patient. This is actually our problem here. Apart from that, it is an important data for us that such a large-scale study shows that there is no difference in prostate enlargement or prostate cancer between patient groups who receive testosterone treatment and those who do not. And these patients are over a certain age. So there are patients over the age of 40. Because this study also tried to answer the question of whether cardiac patients will have problems with cardiac diseases if they use testosterone. This is actually the purpose of the study. It is a big study. Because the FDA has asked for more research on testosterone and heart health. They wanted more data on this subject. In this regard, data has been obtained showing that testosterone will not cause any problems with heart health. Because patients are afraid that if they take testosterone for a long time, they might suffer from heart problems or prostate cancer or prostate enlargement. But the data from this large study showed that there would be no difference in terms of cardiac problems, no difference in terms of prostate enlargement and no difference in terms of prostate cancer. So that's the situation with testosterone therapy and prostate enlargement in general. Thank you for listening.